There was no way for me to not have my quality of life completely changed by visual snow. I couldn't just get in the car and drive to campus anymore if I had to go to class. Sometimes I couldn't even see well, and I felt like that would be a hazard to drive. But they don't have handicap passes for people with visual snow. They don't have buses for people with visual snow, things like that. So I had to get rides from other people sometimes on days where my snow was really bad. Sometimes if I was sitting in the back of class, right, elevated up at the top, looking down at my professor and the podium where they were standing, I couldn't even see them anymore. So my other senses had to become a little more heightened, had to listen more closely, feel things more deeply. I even prepared myself for the worst if I potentially went blind, or there were days when the snow was just too much for me to see with. I would start actually closing my eyes and try to function with my eyes closed, because I feared that one day what I was seeing might be too much. Also, if you go to concerts or you like to go out dancing, which I did, the lights that they have there can be way too overwhelming. It's too much visual stimuli for someone with visual snow, and you see the after images of the lights and fire, or whatever they have, any pyrotechnics at shows or clubs, and they remain there, at least for me in my field of vision, for hours after I see them. My brain doesn't know how to shut it off. At least that's the theory.
Quality of life for somebody with visual snow, it's difficult for somebody like me to articulate, and I think it's incredibly variable. We're not talking about one set of experiences. And I was saying before, some individuals are mildly discomforted by what is perceived as a fairly minor deficit, and right the way through the spectrum to somebody who's incredibly disabled, not just by the snow, but all of the associated symptoms as well. So it really does sit on a spectrum in terms of the outcomes and the deficits and the quality of life aspects for individual patients.
Mental phenomena in visual snow are not part of the syndrome. I think they're part of the interaction with the medical profession more so than anything else. I think they're secondary phenomena. If you've got a chronic disease and no one thinks it's particularly serious, and yet you're finding it disabling, the secondary effect of that is to produce depression, sometimes anxiety, and I don't think it's uncommon to find those in patients. But in general, and I won't say absolutely, they are alleviated quite substantially by having a significant explanation of what visual snow syndrome is, and also some reassurance that they're not actually going to go blind, even though we can't actually offer them any certain treatment at this time. So I think that the psychological phenomena as such are largely secondary rather than primary phenomena.
As far as non-visual system, there's really no complaints that are non-visual, except the frequency of tinnitus, a similar situation in hearing. And that noise is also a pink noise generally. So most of the people report tinnitus and visual snow both present in their hearing and visual system. So that helps us. That probably leads to an area on the side of the head, which is generally called the association areas of the brain. Because something wrong there would logically interfere with tinnitus or the hearing and the visual system. And it might even show up as taste if we get down to that level of detail in the future.
In terms of how this disrupts life, you have to think how important vision is to people in general terms. And as Dr. Fielding will discuss, and as I will discuss in our talks tomorrow, 48% of all nerve cells that enter and leave the nervous system are related to vision and control of eye movements, and 53% of cerebral circuitry relates to vision and control of eye movements. So more than 80% of all sensory perception is visual. Now with visual snow, for many people, you're providing a disrupted sensory environment, and you're taking away maybe 40% of your capacity to appreciate that environment. it can be very disruptive. And not only that, it changes as time goes through, and change also is disruptive over and above the fact that you're losing some vision. It can be profoundly disruptive.
I've seen patients with visual snow who are bothered but not stopped by it. I've seen patients with visual snow who are significantly impaired by it. And I've seen patients with visual snow whose life is crucified by it. So if you take someone who's got significant visual disturbance, and imagine that your job was that you had to use a computer and you're a graphic designer. And all of a sudden, moving over a period of a couple of years, you developed this disturbance that was there all the time. And your job was as a graphic designer. Life is ruined. If your job is to mow lawns, it may impact you less, you may notice it less. I have colleagues in neurology who have it. It doesn't seem to have impacted them as much. So the impact is an interaction between how bad they have the visual snow and what it is that they do in their life.
Visual snow can also be associated with other things, as mentioned, and that includes migraines, that includes numbness and tingling in your hands and your feet, and a whole bunch of other things. But I think the visual symptoms of visual snow plus 2 of the 4 that I mentioned is the main diagnostic criteria. But also, this is once everything is ruled out. So normal brain normal brain pathology, meaning there's no tumors, there's no masses, and your eye exam is completely normal.
The worst thing about having visual snow for me was actually not being able to look out over the sunset where I live, the horizon. It's really beautiful, and it was something I look forward to doing every day when I got up. But because of all the lights that I see and the snow that covers my vision, I can't even appreciate something as simple as the sunset anymore. And when you look up at the sky, well, for most visual snow patients, when you look up at the sky, you can't not focus on everything that's going on in front of you, because our visual snow becomes extremely prominent on clear backgrounds. From nature to everyday activities, there's a lot of limitations because of visual snow.